Hi, I'm Dr. Greg Cason for WebbyHealth.com. Are you shy around other people? If so, you have something in common with up to 50% of the population. But a smaller number of people become so sick with fear around others that they suffer from a severe disorder known as social anxiety disorder. More exaggerated than shyness, social anxiety disorder, sometimes called social phobia, is an inability to perform certain behaviors while other people are watching. The most common form is public speaking, but also includes things like performing on stage, eating at a restaurant, writing a check for a cashier, and primarily for men, using a public urinal. What's common about each of these situations is that a person is required to do something while knowing that others may be watching or perhaps even evaluating. When they're alone, they tend to have no problems doing any of these things. Up to 13% of all people report having this disorder at some time in their lives, making it the third most common psychiatric disorder. But one of the most troubling findings is that 36% of people who have it report experiencing symptoms for 10 years or more before ever seeking help. Social anxiety disorder is often selective. Some people may have an intense fear of talking to a salesperson or giving a speech, but they may be comfortable in other similar settings. Other people may become anxious during routine activities such as starting a conversation with a stranger or a person in authority, or participating in meetings or classes, or even dating or attending parties. Now, although they recognize that the fear is excessive and unreasonable, people with social anxiety disorder feel powerless against their own anxiety. They're terrified they will embarrass or humiliate themselves. The anxiety can interfere significantly with their jobs and social life, making it difficult to do everyday activities and have friendships and romantic relationships. Now, physical symptoms of social anxiety disorder may include blushing, profuse sweating, trembling, nausea, rapid heartbeat, shortness of breath, dizziness, and headaches. Now, social anxiety disorder usually begins in early childhood or adolescence. But how do people develop this disorder? Now, it's thought that a person inherits a biological vulnerability to be anxious or socially inhibited, and then that person in a very stressful or even a traumatic social situation where he performs poorly or may even have a panic attack. He then learns to become anxious in other similar social situations and generally tries to avoid them. Now, anti-anxiety and antidepressant medications are sometimes prescribed for those with this disorder. Also, cognitive behavioral therapy has been shown to be highly effective with social anxiety disorder, especially when combined with group therapy that uses behavioral techniques to help the person have more successful and effective social experiences. Now, if you would like more information about this or other anxiety disorders, visit the Anxiety Disorders Association of America website at www.adaa.org. Now, if you would like to know more about me, you may go to my website at www.drgreg.com. I'm Dr. Greg Cason for WebbyHealth.com. Thanks for watching.